This CD contains the document Accessible Information, Your Views, published by NHS England. Accessible Information, Your Views. NHS England's main aim is to improve people's health. We want to make sure that people can understand the information they're given about their health and care. We also want everyone to be able to get involved in decisions that affect them. We know that some people need information in a different format or help to communicate or explain what they think. We're going to write a new guidebook for NHS and social care organisations across England, such as your doctor, hospital or council. The guidebook will be an information standard, which is a set of rules which organisations must follow. The guidebook will tell organisations how they should make sure that patients, service users and carers can understand the information that they're given. This includes making sure that people get information in different formats if they need it, for example in large print, braille or easy words and pictures. The guidebook will also tell organisations how they should make sure that people get any support with communication that they need, for example through having a British Sign Language (BSL) interpreter or an advocate with them. We would like to know what you think before we write this guidebook. If you use health and social care services now, we would also like to know if you get information in a format you can understand and if you get support with communication if you need it. This will help us to see if our guidebook makes things better. You can find out more information about this work and about other ways to have your say on our website at www.england.nhs.uk/accessible-info. If you have a question about this work, you can email us at england.nhs.participation@nhs.net or telephone 0113 825 1324. Thank you for helping us with this work. So, moving on now to the survey itself. Now, this survey is for patients, service users and carers. There are different surveys for health and social care professionals and organisations, for voluntary organisations and providers of information or communication support. Now, there are 3 parts to this survey. Part 1 asks questions about your experiences of using NHS and social care services. We want to know if you understand the information you're given and if you get support with communication if you need it. The NHS services include your doctor, dentist or hospital. Social care services include a care home or day centre or support from a social worker. Now, part 2 asks questions about how organisations should find out about people's information and communication support needs and how they should make sure they meet their needs. And part 3 asks questions about things like your age and religion. This will help us to make sure that we've asked lots of different people for their views. You don't have to answer these questions if you do not want to do so. So moving on now to part 1, your experiences. Question 1. Do you find it difficult or do you need support to see, to hear, to speak, to read or to understand what is being said? For example, if you are deaf, blind, have some hearing or visual loss or have a learning disability, then please tick one of the boxes. And boxes 1, 2, 3, 4, 5 and 6 are as follows. Always, most of the time is box 2, sometimes box 3, not very often, box 4, no, never, in which case go to part 2, and prefer not to say, again go to part 2, not question 2, part 2. So if it's no, never or prefer not to say, then miss out the rest of part 1 and go straight on to part 2. Question 2. Do you usually get the communication support you need when you use NHS services? For example, if you need a British Sign Language interpreter or communication support at your appointment. Again, please tick one of the boxes, and they are always, most of the time, sometimes, not very often, no, never. I do not need any communication support. I do not use NHS services and prefer not to say. Question 3. Do you usually get information in a format you can understand when you use NHS services? For example, information in easy read, braille or audio. Please tick one box again. They are always, most of the time, sometimes, not very often, no never, and I do not need information in a specific format, and I do not use NHS services and prefer not to say. Question 4. Do you think there is any information you're missing out on when you use NHS services? Again, please tick one box. They are almost all information, most of the information, some information, not very much information, no, I get all the information I need, I do not need information, I do not know, I do not use NHS services, and I prefer not to say. Question 5. Do you usually get the communication support you need when you use social care services? For example, if you need a British Sign Language interpreter or a communication support worker at your appointment. Again, please tick one of the following boxes. Always, most of the time, sometimes, not very often, no never, I do not need any communication support, I do not use social care services and prefer not to say. Question 6. Do you usually get information in a format you can understand when you use social care services? For example, information in easy read, braille or audio. Again, please tick one of the following boxes. They are always, most of the time, sometimes, not very often, no never, I don't need information in a specific format, I don't use social care services, and I prefer not to say. Question 7. Do you think there's any information you're missing out on when you use social care services? Please tick one of the following boxes. Almost all information, most of the information, some information, not very much information, no, I get the information I need, I do not need information, I do not know, I do not use social care services, and I prefer not to say. Question 8. If health and social care organisations always gave you information in a format you could understand, and if you always got the support you needed to communicate, what difference would this make to you? And then there are 5 blank lines on which you can write your answer. Question 9. If you have any other comments you'd like to make about your experiences of getting the support you need from health and social care organisations, please tell us here. And there's a further 5 blank lines for you to write in your experiences and opinions. Moving on now to part 2 then, getting the right information and communication support. We'd like you to tell us how you think health and social care organisations should find out about people's information and communication support needs. So, moving on with question 10. We think that your doctor, care worker or a receptionist at a hospital should ask everyone if they need any support. We want to write a question for them to ask so that everyone is asked the same. What do you think about the question below? And the question, the sample question is, do you find it difficult or do you need support to see, to hear, to speak, to read or to understand what is being said? Now, is this a good question? Please tick one of the following boxes. It's a very good question, don't change it. It's a good question, but it could be better. It's an okay question, but it could be better. It's not a good question, it should be changed. It's really not a good question and should not be used. I'm not sure, and I prefer not to say. And please explain your answer, and there's a couple of blank lines under there for you to write any explanations you feel you may need to give. Question 11. How do you think we should ask people about their information and communication support needs? Please tick as many boxes as you like. The boxes are as follows: email, face-to-face, by letter, by online form, on a website, for example, by the telephone, by text, an SMS message, prefer not to say, or in another way, please tell us, and there's a blank line for you to add your own suggestion in, and finally, no preference, I do not mind. Question 12. It can take time for organisations to get information in different formats or to find communication support workers. Sometimes things can be planned in advance. For example, if you have an appointment in a few days' time, or if you live in a care home and always use the same support. Sometimes you need treatment or support in an emergency and there's no warning, or it might be late at night. What should organisations do to make sure that you can get communication support and information in the right format quickly? And there's 3 blank lines for you to write any opinions that you may have. Question 13. Is there anything else we should think about when finding out about people's information or communication support needs? Again, 3 blank lines for your reply. Question 14. Is there anything else that we should think about when recording or sharing information about people's information or communication support needs? And again, there are 3 blank lines for you to write your answer. Moving on now to Part 3, diversity monitoring questions. Now, we're asking these questions because we do want to make sure that we've asked lots of different people for their views. You don't have to answer these questions if you don't want to. So, question 15. What was your age at your last birthday? Either fill in the number of years or tick the prefer not to say box. Question 16. Are your day-to-day activities limited because of a health problem or disability which has lasted or is expected to last at least 12 months? This includes any issues or problems related to old age. Yes, limited a lot. Yes, limited a little. No, or prefer not to say. One of 4 boxes. Question 17. If you answered yes to question 16, please tick one of the following boxes. Was it vision, for example, due to blindness or partial sight? Was it hearing, due to deafness or partial hearing? Was it mobility, such as difficulty walking short distances, climbing stairs, lifting and carrying objects? Was it learning or concentrating or remembering? Was it mental health? Was it stamina or breathing difficulty? Was it social or behavioural issues? For example, due to neurodiverse conditions such as autism, attention deficit disorder, or Asperger's syndrome? Was it other impairment? Or do you prefer not to say, or is it even not applicable to you? Question 18. What is your ethnic group? Choose one section from A to E and then tick one box to indicate your ethnic group. So the A to E sections are A, white, B, mixed, C, Asian or British Asian, D, black or British black, E, other ethnic group. And then within those, there are different selections. Let's look at section A first. For under white, are you Welsh, English, Scottish, Northern Irish, British? Or are you Irish? Are you Gypsy or Irish traveller? Or are you any other white background? 4 boxes to choose from there. However, if you chose B, which was mixed, are you mixed white and black Caribbean, white and black African, white and Asian, or any other mixed background? That's 4 boxes to tick under section B. However, if you chose section C, Asian or Asian British, are you Indian, Pakistani, Bangladeshi, Chinese, or any other Asian background? That's 5 choices. If you chose D, black or black British, are you Caribbean, African, or any other black background? 3 options there. And E, if you chose E, which was other ethnic group, are you perhaps Arab or any other? Please write in, and there's a room for you to write in. And finally, do you prefer not to say? Question 19. What is your sex? Are you, 4 options here, by the way. Are you male? Are you female? Or are you intersex? Or do you prefer not to say? Question 20. Have you gone through any part of a process, or do you intend to, including thoughts or actions, to change from the physical sexual appearance you had at birth to the gender you now identify with? This could include changing your name, your appearance and the way you dress, or taking hormones, or having gender-confirming surgery. Is the answer yes, or no, or do you prefer not to say? 3 tick box options there. 21. What is your religion? Please tick one of the following boxes. Are you no religion? Are you Christian, which includes Church of England, Catholic, Protestant and all other Christian denominations? Are you Buddhist? Are you Hindu? Are you Jewish or Muslim or Sikh? Or any other religion? Please write in. Or do you prefer not to say? Question 22. Which of the following options best describes your sexual orientation? Are you heterosexual, otherwise known as straight? Are you lesbian or a gay woman? Are you a gay man? Are you bisexual? Or are you other? Or do you prefer not to say? Question 23. Do you look after or give help or support to family members, friends, neighbours or others because of either long-term physical or mental ill health, disability or problems related to old age? Is it yes or no, or you prefer not to say? Thank you for answering our questions. Please return your survey by email to england.nhs.participation@nhs.net. That's electronically, or post it to Sarah Marsay, Public Voice Team, Accessible Information, NHS England, 5E01, Quarry House, Quarry Hill, Leeds, LS2 7UE. Please return your completed survey by Friday the 21st of February, in 2014. That's Friday the 21st of February 2014. If you have any questions or would like some support, please email us at england.nhs.participation@nhs.net or call us on 0113 825 1324. And that completes the reading of this accessible information views gathering exercise, the document, the public survey aiming to improve people's health. Thank you for listening.